Secretary to the Minister of National Defense.
Thank you very much, Madam Speaker, and I'd like to share my time with the member for Dartmouth Cole Harbour, please. It is such an honor to join colleagues this evening for this incredibly important debate on one of the greatest challenges that has ever faced our country. Many of my honourable colleagues this evening have spoken about the whole of government effort to be able to provide vaccines to Canadians and to keep Canadians safe. I would like to focus my remarks this evening on one specific aspect of our response, and that is the important work that is being done by our defence team and the Canadian Armed Forces. No matter the mission, Canadian Armed Forces members have continued to demonstrate the very best that our country has to offer. Cela est plus clair que jamais, alors que nous sommes en transition pour soutenir la distribution des vaccins. Ce soir, j'aimerais parler de la façon dont les forces armées canadiennes et le ministère de la Défense nationale ont été des partenaires fiables dans notre lutte pan-gouvernementale contre le COVID-19 depuis le début de la pandémie. As we all know, the COVID-19 pandemic has required us all to make important changes to our lives and to our routines in order to stay safe. This has truly required a whole-of-nation effort, from individuals to businesses to our government. Everyone has an important role to play in our response to COVID-19, including our defense team. Most notably, since the pandemic first emerged here in Canada, Canadian Armed Forces members and D&D personnel have been working closely with the Public Health Agency of Canada. And starting in October, when the Public Health Agency of Canada began to develop its strategy to distribute vaccines across the country, defense team members once again answered the call. A number of Canadian Armed Forces members and civilian staff have been temporarily reassigned to support the Public Health Agency of Canada in the planning and coordination of these efforts. Parmi eux, le Major Général Danny Fortin, qui a été nommé vice-président de la logistique et des opérations en novembre. Il travaille aux côtés d'autres dirigeants au sein du groupe de travail de la ASPC sur le déploiement des vaccins. He is well positioned for this role, having led complex operations as the first commander of the NATO mission in Iraq from 2018 to 2019. Major General Fortin is joined by several defense team logistics experts, operation planners, healthcare workers, engineers, and information technology and systems experts. Each of these defense team personnel bring a wealth of knowledge and experience to the table that are critical to facilitating vaccine delivery, ensuring that vaccines are safely stored and effectively distributed to our provinces and territories. Canadians can have full confidence in their military to support this national effort under Operation Vector. In December, Canadian Armed Forces members delivered 5 medical-grade freezers to 2 of our northern territories in support of our Public Health Agency of Canada partners. Earlier this month, in Nain, Newfoundland and Labrador, they helped transport vulnerable individuals to and from vaccination sites. Last week, they helped local authorities in Watson Lake, Yukon, tear down a temporary vaccine site in the community. And the Canadian Armed Forces are working closely with the Government of Ontario and the Anishinaabe Nation to finalize the planning to deploy up to 32 communities in Northern Ontario to help in the public health vaccination program. Canadian Armed Forces units across the country are ready to support civilian authorities if and when they are needed. However, it is important to note that their primary role is not to administer vaccines. That important responsibility rests with local health authorities. Madame la Présidente, en ce moment crucial de la lutte du Canada contre le COVID-19, les membres de l'équipe de défense apportent un soutien essentiel à l'ASPC. The Department of National Defence and the Canadian Armed Forces remain ready and responsive at all times and have been since the beginning of the COVID-19 pandemic. Through it all, Canadians have been able to depend on the dedicated professionals on the defense team to help them and to save lives. This past year has been a testament to their adaptability and resilience. And it is a stark reminder of how Canadian Armed Forces members risk their lives every single day to protect and defend our nation and its people. Despite the unique challenges of the past year, they have continued to make Canadians proud. In February of last year, Canadian Armed Forces members were integral in bringing Canadians home in the face of the growing threat of coronavirus. Through this work, we know how critical it is that Canadian Armed Forces members remain safe and healthy to deploy when needed. That's why Defence Team leadership took decisive action to protect all employees and Canadian Armed Forces. Our focus was on ensuring that critical capabilities remained intact, and many Canadian Armed Forces members came home from or delayed deploying on operations abroad. Toutes ces mesures ont permis à nos membres d'être prêts à répondre à l'appel pour aider les Canadiennes et les Canadiens. Et cet appel est arrivé rapidement. By April, thousands of Canadian Armed Forces members were assigned to Operation Laser, the mission to support our government's response to COVID-19. They worked on the front lines alongside healthcare professionals in 54 long-term care facilities, 47 in Quebec and 7 in Ontario. En Ontario et au Manitoba, les membres des Forces armées canadiennes ont également aidé l'Agence de santé publique du Canada à gérer les équipements de protection individuelle dans les entrepôts afin qu'ils puissent être distribués rapidement à ceux qui en avaient besoin. And more than 1,200 Canadian Rangers deployed in northern and Indigenous communities across the country, providing essential support when it was needed the most. Recently, as cases began to surge again in the second wave in the fall and the winter months, Canadian Armed Forces members answered the call once again in several Indigenous communities in Saskatchewan, Manitoba, Ontario, and Quebec. Among other critical tasks, Canadian Armed Forces medical assistance teams helped establish and operate alternative isolation areas in these regions. And Canadian Rangers are currently supporting the Hatchet Lake Dene-Souliné First Nation in Saskatchewan, delivering food, firewood, and care packages to members of the community. They are also ensuring that community leaders have the information that they need to mitigate risk and put effective health measures in place for their residents. Madam Speaker, our Canadian Armed Forces are helping out in some of the hardest hit communities in Canada and deploying abroad to support our partners and allies in training, deterrence, and peace support efforts. While they protect the health and safety of Canadians, it is our job to protect theirs. We have worked hard to ensure that they have the appropriate PPE for each deployment, that they closely follow public health measures and quarantine requirements as needed. Canadian Armed Forces members have begun to receive the vaccine, starting with frontline healthcare providers. All of this ensures that they remain safe and ready to help Canadians through the pandemic and beyond. Il faudra du temps avant qu'on puisse revenir à la vie normale. Il faut de la patience et notre ferme volonté de faire en sorte que les Canadiens aient accès à un vaccin sûr et efficace. But I'm confident in the work of the defense team and our partners across government to reach that light at the end of the tunnel and bring this pandemic to an end. Thank you very much, Madam Speaker.